looking at mainly lifestyle medical approach, and some of it I just hinted in my presentation just gone by. And this is really basically focusing on a few things such as sleep, nutrition, physical activity, relationships, harmful substances, mental well-being. And let's move on to the next slide when you're ready. Again, I think this is a Kate slide, so of course I'm not going to go through each and every point on this. But what is really important is, as healthcare providers, we're looking to improve the general health of the patients, besides particularly looking at the symptoms that women have. And what we try to do is we try to reduce the risk for future. For example, looking at the bone health, the cardiovascular health, cutting down any cancer risk that could come from lifestyle, looking after the psychological or mental well-being, as well as their physical metabolic health. And a part of this will be again covered because we have a dedicated session on lifestyle and metabolic health related to menopause. Next slide, please. And everything is connected to everything. So again, when we look at menopausal sleep disturbances, we know that sleep disturbances are a typical and a classic symptoms of menopausal transition. For some women, they happen very early in transition during perimenopause. For others, it will happen slightly later on as the menopausal hormones completely become close to baseline. And the sleep issues can be just simply waking up more times during the night, or it could be disturbed sleep because the quality of the sleep is poor. So the woman may go to sleep but keep having a poorer quality rather than the sleep that was before menopausal transition. It may be just one episode of getting up and then finding it very difficult to go back to sleep. And there are various studies in relation to sleep to find out, is it because of the hot flushes or the night sweat that the sleep is impacted? Or as it is because of just the nature of the lack of hormones causing a direct impact on the sleep, and not just because of the hot flashes and the night sweat. And it appears to be the second, that there is some changes to the sleep center in the brain with the lack of estrogen, progesterone, and the fluctuations that happen that directly impact the sleep rather than just the vasomotor symptoms, the hot flashes or the night sweats causing disturbance. And all hormones are involved. There seems to be contribution from estrogen, progesterone, but also some observational new studies suggesting testosterone could be linked, and we need more evidence for that. Next slide, please. Again, looking at the bones, we know that as the woman will progress through menopausal transition, and we're talking about natural transition rather than POI or early menopause, the bone density will drop. And this is because osteoblasts, the bone-making cells, are directly stimulated by estradiol. And so therefore, if that drive is gone, you will find that the bone mineral density becomes less as the time progresses. And you could have up to a 10% drop in the bone density over 5 or 10 years of typical menopausal transition. And what do we say about preventing bone loss or improving bone health? Of course, we discussed in the chat some while ago. Weight-bearing exercise, something that takes you against the gravity, not swimming, but jumping, running, trampolining, brisk walking, any sort of jogging, or sort of exercise using weight lifting. All those sort of weight-bearing exercises are excellent for bone. Besides that, we recommend vitamin D. For those who have vitamin D supplement, that's great. Anywhere between 400 up to 1,000 units a day has been recommended in different studies, especially in winter months when we don't get a lot of sunlight. Vitamin D is ideal because it pushes the calcium into the bone. For those with a good diet, balanced diet, calcium comes through the food. We try and avoid supplements of calcium. But for those who may have a dietary issue because of background medical conditions or do not have a good, healthy, calcium-rich diet, calcium supplementation up to 800 to 1,000 milligram alongside vitamin D would be recommended. But of course, besides this bone health, you have other bits. For example, bone health will be addressed by HRT. So while we say HRT is a treatment for symptoms, it has the indirect benefit of improving bone. And previously, we used to say HRT is the first line intervention, a medical intervention to be considered for prevention of osteopenia or osteoporosis for women until the age of 50. The BMS has now extended that to 60. So if you have a person who's doing everything lifestyle-wise to prevent osteopenia or osteoporosis, they have symptoms of menopause, then HRT would be a good choice because it would not only treat the symptoms of menopause, but also improve bone health and prevent osteopenia or osteoporosis. Beyond the age of 60, of course, then it's individualization, how long the HRT is continued based on the symptoms and the bone density scan. This is about, I think you might have gone too fast there.
Sorry.
So again, we talked about the bone. I think one slide back, Fiona, for me. There was also mentioned about the cholesterol, LDL and HDL, and gut health. These are two aspects which interact partly with the whole symptoms as well as the bone, heart, and gut health. Menopause does cause changes in gut. We know that the microbiotic flora in the gut will change with the changes in hormones. What we don't understand is what those changes mean. Right now, there are a lot of studies going on to find out what these bacterial flora changes mean. What are the changes in estrogen, progesterone that affect gut function? For example, we know that the gut bowel emptying slows down during the transition. What is the impact of this slowing down? Does it cause some particular forms of bacterial flora to grow or not? We do not understand the significance of this completely. Again, part of this will be linked to the metabolic consequences and the weight changes that happen during menopause later in one of the sessions. So I'm going to skip that over, but hopefully we'll catch up a little bit more on that as we come to that session. Next slide, please. And the next one. So again, stress plays an important role in any medical transition, and so also during menopause. We have already heard from the speakers in the morning that the anxiety levels will usually increase during perimenopause, menopause for many women, and the hormone changes, of course, don't help. There may be situations related to family, other circumstances at work, or personal circumstances, or financial worries related to caring for parents. There may be worries related to children, and all that will have a knock-on effect on, one, what symptoms are experienced and how severe they are, but also the interventions. How effectively do HRT or non-HRT interventions work? And some of the interventions may particularly work well for psychological symptoms or psychological problems. For example, CBT, or other forms of counseling, psychological support, and therapy may be particularly useful for these bits of symptoms alongside HRT if it's required for any of these physical or the psychological symptoms. Next slide, please. And then again, you want to prevent any of the harm coming from the lifestyle choices. So making sure that there is no excess alcohol, making sure there is no smoking, making sure there is adequate sleep, which does not impact on heart health or cardiac health, avoiding triggers, avoiding symptom triggers, for example, alcohol, spicy food, or trying to keep workplace easy in terms of temperature regulation, uniforms. All those sort of small things will add up in trying to avoid the harmful substances from, one, exacerbating symptoms of menopause, but also impact on the future risk of cancers or chronic health conditions. And therefore, lifestyle factors become so important during the transition. So this is an opportunity during perimenopause, menopause to look at all these factors, which would then have a significant impact on postmenopausal health for the 20, 30, 40 years of the woman's life. Next slide, please. Supporting positive lifestyle adjustments. And how do we get there? Is it easy? It's of course not easy. Changing someone's lifestyle, trying to eat healthy, exercise regularly, look after psychological health, setting up boundaries can take a lot of change, and it may not be easy for everyone in a busy day-to-day modern life. So educating, motivating, that's key. Setting up tiny goals, achievable goals within one's day-to-day activities is really key. One of the criticisms that we've often received in clinics as healthcare professionals is, I was told to go and lose weight, and I wasn't really given any sympathetic advice. I was given any practical advice. And healthcare professionals have to engage with their patients, look at their lifestyle, and suggest small changes at a time, which are practical, which will fit within their daily routine. And those small changes will be the first that will then give further motivation for that individual to achieve change. Now, I'm not a dietary expert or I'm not an exercise expert, But we can take help from our healthcare allies who specialize in this area, whether it's a nutritionist, a dietitian, a physiotherapist, a trainer, and really working with them is going to get us to achieve these tiny goals with our patients. Accountability, commitments, okay, setting up accountability, setting up goals, following them up. We have lots of modern technology to track progress, and then if the goals are achieved, reward patients. Sometimes the goals may not be achieved, then it needs to figure out why the goals were not achieved and work again. Tracking progress, as I said, and finally, that process leads to a habit formation. So it's about getting this process done so that small habits are formed, which are all aiming towards a positive lifestyle and improving future long-term health.